What should I understand about reproductive cancer screening tests? Imagine catching a problem early before it becomes serious. That's what screening tests aim to do for reproductive cancers. These tests are designed to find signs of cancer or precancerous changes in reproductive organs, like the cervix in women and the testicles in men. Early detection can lead to more effective treatment and better health outcomes. For women, the main screening tools for cervical cancer are the Pap test and the human papillomavirus test. The Pap test involves collecting cells from the cervix using a small brush during a pelvic exam. These cells are then examined in a lab to look for abnormal changes that might develop into cancer. The HPV test checks for high-risk types of the human papillomavirus, which is strongly linked to cervical cancer. These tests can be done separately or together, called co-testing. Screening usually starts at age 21 and continues until about age 65, with the frequency depending on age and health history. Regular screening has helped reduce the number of cases and deaths from cervical cancer over the years. The process for cervical cancer screening is simple and quick. A healthcare provider gently inserts a speculum into the vagina to access the cervix. Then, they collect cells with a small brush or spatula. The collected samples are sent to a lab for analysis. This routine helps catch abnormal cells early, sometimes even before they turn into cancer, which allows for early treatment or close monitoring. When it comes to testicular cancer, there is no standard screening test recommended for men without symptoms. Instead, men are encouraged to perform regular self-examinations of their testicles. This means feeling for any unusual lumps, swelling, or changes in size or texture. If anything feels abnormal or different from usual, it's important to see a healthcare professional promptly. Early detection through awareness and self-examination can make a big difference in treatment success. It's important to understand that screening tests are tools to identify potential problems early, but they are not perfect. False positives can happen, leading to unnecessary worry or additional testing. False negatives can also occur, meaning a cancer might be missed. That's why screening recommendations are carefully balanced and personalized based on individual risk factors, age, and health history. Emerging research is exploring new ways to improve screening accuracy, such as detecting specific viral activity markers or DNA changes associated with cervical cancer. These advanced methods might help distinguish infections that are likely to develop into cancer from those that will resolve on their own. However, these are still being studied and are not yet part of routine practice. Always remember, screening does not replace professional medical advice. If you notice symptoms like unusual bleeding, pain, or lumps, or if you have concerns about your health, consult a healthcare provider. They can give personalized guidance based on your medical history and risk factors. In summary, reproductive cancer screening tests are essential tools for prevention and early detection. Understanding what these tests involve, their benefits, and their limitations helps you make informed decisions about your health. Regular screening, combined with professional medical advice, can play a vital role in catching issues early and improving outcomes. Always prioritize talking to healthcare professionals for personalized recommendations and care.